Brew 1 uncle drank 4 cups of tea before fasting blood sugar test. One person gave half a bucket for urine test. And another guy entered MRI room wearing belt, chain, coins, phone, watch, basically entire metal shop. Today we are exposing medical test mistakes people make. Weird myths Indians still believe. Why labs ask for midstream urine. How much blood doctors actually take. Why overfasting can ruin your reports. And why MRI machine can turn your forgotten coins into missiles. Watch till the end because one small mistake can completely change your report. Part 1. Blood tests. The moment nurses say, "We just need a small blood sample," patients immediately think, this is the end. Where is blood taken from? Usually from veins near the elbow, forearm veins, most common vein, median cubital vein. How much blood is actually taken? People behave like doctors are stealing blood for black market vampires. Reality. Most routine tests require only 10 milliliters blood. That's roughly 1/2 to 2 teaspoons. Your body contains around 5 liters of blood. So calm down, Dracula Jr. Myth has hone. If blood is taken, body becomes weak forever. False. Body replaces the blood naturally. CBC, complete blood count checks, hemoglobin, WBC platelets. Simple interpretation. Finding meaning low HB means anemia. High WBC indicates infection. Low platelets, bleeding risk, fasting needed? No. You can eat peacefully before CBC. Your samosa is safe. Blood sugar tests. Fasting blood sugar, ppbs, HbA1c. Fasting blood sugar requires 8-12 hours fasting. What people think fasting means. Tea is liquid, so it doesn't count. No, anti-tea. Coffee with sugar or milk can affect results. Can you drink water? Yes. Actually, doctors want you to drink water. Why? Prevents dehydration. Veins become easier to find. Without water, your veins disappear like your motivation on Monday mornings. Myth #2. Longer fasting equals more accurate report. Some people fast 20-24 hours like they're preparing for spiritual enlightenment. Over-fasting can cause low blood sugar. Dehydration can cause false lipid values and weakness. So, follow only advised fasting duration. HbA1c explained. This test is basically your body's secret report card. HbA1c shows average blood sugar over last 2-3 months. Fasting needed for HbA1c? No. You can eat before this test. The lab is judging your past, not your breakfast. HbA1c meaning below 5.7% is normal. 5,76,4% pré-diabetes. Above 6.5% diabetes. Lipid profile checks. Cholesterol, LDL, HDL, triglycerides. Requires 9-12 hours fasting. Myth #3. If cholesterol is high, just test again tomorrow after eating salad. That's not how science works, uncle. Part 2. Urine tests. Now we enter the most confusing medical instruction ever given to humanity. Please give midstream urine sample. Patients. What is midstream urine? Correct method. 1. Start urinating first. 2. Don't collect first few drops. 3. Collect middle portion. Why midstream? First urine may contain dirt, skin bacteria, contaminants. Midstream gives cleaner sample, more accurate report. How much urine is needed? Usually 20-30 milliliters. Not the full tank capacity. Myth, #4. More urine equals more accurate results. Best time for urine test? Early morning sample preferred. Because more concentrated, easier to detect abnormalities. Precautions, if menstruating. Inform lab, clean area properly. Postpone routine test if possible, because menstrual blood may falsely show. Blood in urine, protein, infection signs. Part 3, scans and imaging. X-ray used for
fracture,
pneumonia, TB. Important, pregnancy warning. X-rays use radiation, so pregnant women should inform doctors before X-ray. Myth #5. One X-ray gives superpowers. Sorry bro, you're not becoming Spider-Man. USG ultrasonography uses sound waves. Used for pregnancy, kidney stones, abdomen. Full bladder for pregnancy scan. Not always required, usually needed. Early pregnancy scans, usually not needed. Later pregnancy scans, CT scan, full form. Computed tomography, used for bleeding, brain injury, tumors. MRI, magnetic resonance imaging. This machine is basically a giant magnet from another planet. Remove all metal objects. Remove jewelry, coins, watches, belt, hairpins, phone, ATM cards. Important. Tell doctor if you have pacemaker, metal implants, surgical clips. Common test mistakes: eating before fasting tests, drinking tea before sugar test, giving first urine instead of midstream, dirty urine container, carrying metal inside MRI room, hiding pregnancy before X-ray. Rapid fire recap. CBC infection divided by anemia. HbA1c last 3 months sugar. Water allowed during fasting. Midstream urine equals accurate urine test. MRI, Usmanier. X-ray uses radiation. Full bladder not always needed for pregnancy scan. So, today we learned tea destroys fasting. MRI can expose hidden coins in your pocket. Labs don't need 1 bucket of urine. And doctors are not secretly stealing all your blood. Next time you go for a blood test, don't panic, don't overfast, and please don't carry your entire jewelry collection into MRI. Send this video to that one friend who still thinks water breaks fasting. Like, share, subscribe, because medical knowledge should save lives and entertain people.